I would like to welcome you all to this refresher webinar on the Quality and Improvement Outcomes Framework. I'm Claire Edwards, and joining me in presenting I have Holly Case Wyatt, Dom Gilroy and Sue Robertson. The main aim of the session today is to provide a refresher on the Outcomes Framework. We do understand that it has been a difficult and challenging year for everyone. We recognise that over this time the Outcomes Framework may not have been at the forefront of your mind. We know that things are not yet quite back to any sense of normality, but we hope this refresher will assist in the re-engagement of this process for you and your teams. So the objectives for today's session are to provide an overview of the Quality and Improvement Outcomes Framework, to provide an outline of the self-evaluation and validation process for the baseline, including timelines and guidance for evidence requirements as a result of COVID, to provide a reminder of other resources and support available, and also at the end we will touch on the plans for the future process. I'd like to emphasise that the webinar today will not be going into detail about each of the outcomes. The webinars that go through each outcome in detail are still available on the blog. We will now move on to take a closer look at the Quality and Improvement Outcomes Framework. You will notice in Patrick Mitchell's foreword that he mentions improving service delivery for patients. This is the ultimate aim of all our work in healthcare and is at the centre of the framework. Through the services we provide to whoever we provide them, the end should always be improved services for patients. The Outcomes Framework has two main roles. For knowledge and library services themselves, it provides a tool for driving service improvement and user satisfaction. It provides a framework to consider the outcomes needed for the service and highlights the support and resources needed from the organisation to develop the service. For NHS organisation, it provides quality assurance that the library service they commission or procure are continually developing and improving to meet their needs. However, and just as important, it also challenges the organisation to consider whether they are making the most of the services available from knowledge and library specialists. The framework is there to support you and your service development. Please use it to demonstrate where you are doing well, good practice and innovation, but also highlight where there are difficulties, issues and risks. It will allow for conversation with your organisation. The development of the Outcomes Framework delivered on HE's Knowledge for Healthcare commitment to refresh ALQOF and ensure it continues to drive service improvement. We now have the new Knowledge for Healthcare that sets the direction and defines priorities for the development of knowledge and library services over the next 5 years. The Outcomes Framework is a key enabler in the delivery of knowledge for healthcare, in demonstrating value and ensuring quality knowledge and library services are business critical to the NHS. The Quality and Improvement Outcomes Framework is also integral to both the HE Quality Framework and requirements of the new Education Contract. Both of these again emphasise the requirements and responsibilities of the organisation in relation to implementation of the Outcomes Framework and delivering a quality learning environment. The overarching aim of the outcomes is that NHS organisations and the healthcare workforce deliver an evidence-based National Health Service by accessing high-quality, customer-focused knowledge and evidence service enabled by the expertise of healthcare library and knowledge specialists. Some of these outcomes, for example Outcome 5, are largely the remit of the knowledge and library staff, while others require ongoing interaction between the organisation and its knowledge and library service, for example Outcome 1. This reflects the fact that the outcomes framework is something which should belong to the organisation and not solely the knowledge and library service. It can be used to develop and improve the organisation's approach to and use of knowledge and library services. I will now hand over to Sue to go through the framework structure and outcomes.
We will now start to look at the structure of the outcomes framework itself. For each outcome, the framework has 5 levels, ranging from level 0, not developed, up to level 4. Level 4 suggests that a highly developed service is available to the organisation. Each outcome is also supported by a scope, key questions, and an overview of why the outcome is important, together with outcome-based evidence examples. Outcome 1 focuses on the strategic development of the knowledge and library service. This outcome covers strategic leadership and the goal that the service is business critical to your organisation. In this outcome, the submission will demonstrate how the service underpins organisational priorities in the context of the Knowledge for Healthcare framework. This includes strategic and annual plans with deliverable and evaluated outcomes, the resourcing needed to underpin and deliver your strategic annual plan, senior stakeholder engagement and endorsement. Outcome 2 covers the role of the library team in the mobilising of evidence and internally generated knowledge. Knowledge and evidence that underpins decision-making, innovation and change. This outcome also includes the work on health literacy and patient information, the role in supporting patient information, the rollout of health literacy training, and the provision of high-quality health and well-being information. Outcome 3 highlights how the library team delivers proactive stakeholder and user-focused services. It shows the user base and what is done to market and promote your services to all in your organisation. How the service offer considers any differing needs and requirements. What is done to create, implement and evaluate the service offer. Outcome 4. This covers the requirements for the library team to have the relevant experience and skill mix. Also, the numbers of library staff needed to deliver on strategic priorities. Where appropriate, this outcome includes working in partnership with colleagues from other knowledge and library services. Outcome 5 is about the evidence base. We need to use evidence too, to show how evidence-based practice is integral to the planning, design and delivery of the activities, products and facilities provided. How has improvement to your existing services and the development of new services been as a result of adopted or adapted innovation or good practice? Reviewing the effectiveness of services, sharing your innovations or best practice, and contributing to professional publications. Outcome 6. This outcome will be very familiar to you all. It covers the effectiveness of knowledge and library specialists in collecting evidence to show the impact of their services and how it is used to promote the service, both internally and externally to stakeholders. Impact is defined as the difference or change in an individual or group resulting from the contact with library services. For this outcome, you will be systematically collecting impact case studies, evaluating the responses, and sharing the difference you are making with decision makers in a variety of ways. This could be in presentations, reports, or on social media. I'll now hand over to Dom.
Thank you. So let's move on now and look at how the self-evaluation process works. To provide an overview of the outcomes framework process, we have created this flowchart which outlines the various stages from the self-evaluation by each organisation through to the validation and reporting back to trusts, and then any interventions and service improvement actions which follow. The self-evaluation element of the process is shown in steps 1 and 2 of the flowchart, which is represented by the two bubbles shaded in a darker blue at the top of the flowchart. So we'll look at those now in more detail. So here we are. Here are the two elements of the flowchart which address the self-evaluation. As with previous quality assessment frameworks, the first step then is for organisations to self-evaluate against the outcomes. And this will take place between now and September the 24th, which is the deadline for submissions. Many of you may already have started work on this and be well underway to completing the self-evaluation. All NHS organisations with which Health Education England holds an education contract will be asked to carry out a self-evaluation. Now, we have had a lot of questions about this, so to try and be clear, it's not just all organisations which library services may serve, but only those organisations which hold an education contract, or what used to be called an LDA, a Learning Development Agreement, with Health Education England. So excluded from this is bodies such as public health, clinical commissioning groups, other organisations which won't hold that education contract with HEE. But it does include other NHS trusts with whom you may have an SLA for service delivery. If you're not sure, then please do check with your local HEE library development lead to just check if you're not sure about your local situation. Now, in order to complete your self-evaluation, you will probably want to work with other people from across your team who will bring different perspectives on the outcomes. If you haven't already decided who you want to work with, then do start to get this sorted out, because they'll make the work less focused on any one individual. You'll be able to get more perspectives and share the workload out. It's worth getting the evaluation team together as soon as possible in the process, so you can map out what kinds of evidence you need to capture for each outcome. So thinking about self-evaluation as a process, what do we mean by self-evaluation? Well, it's a continuous process of improvement in which library and knowledge specialists critically examine your services and then decide upon ways in which service improvements can be made. 3 questions we're considering here. How well are we doing? How do we know that that's the case? How do we know we're doing well or not doing well? And what are we going to do next in order to address the areas we feel need improvements? We're asking you to think critically about the services that you provide to your organisation or to organisations if there's more than one, and the impact that these services have on those organisations. It's a chance to reflect on your strengths, highlight and share good practice through the evidence that you provide. And it's also a time to consider areas which will benefit from improvements and then to draw up plans to address these improvements. The process gives you an opportunity to demonstrate value to your users and to evidence the quality of your services to senior stakeholders. So to submit your self-evaluation, there are a couple of forms that we'll be asking you to complete. One of the forms is this, in which you rate your level and state whether you are low, medium or high within that level for each of the outcomes. When you're doing this, we're asking you to try and be realistic about where you feel you sit against the levels. There's nothing to gain from overstating your level of development, particularly at this baseline stage. For each outcome, we will then ask you to write a short narrative. This will detail why you think your organisation has achieved the level you selected in the previous form. It should reference the evidence that you embed in your submission. Let's pause here and just think about what we mean by evidence. Everyone will be asked to submit certain key evidence as part of the pen portrait. These evidence pieces include the strategy, the annual report, the implementation plan, and any service level agreements which you may have in place to deliver library and knowledge services to other organisations. If these documents have different names in your service due to the requirements of your organisation, this is fine, but we just need the equivalents of these documents as they appear in your service. Because validation will be a national process and your submission will be assessed by people from regions other than your own who may not know your service, you will also be asked to write what we're calling a pen portrait or an outline of your service. You will also need to submit and embed any additional evidence which supports your evaluation and narrative. As you saw earlier when we looked at the structure of the outcomes framework, for each outcome we provide examples of the kind of evidence we think may be useful. However, these are just provided as suggestions rather than instructions. Do think carefully about the evidence which you submit and focus on quality rather than quantity. Evidence should be as succinct as possible and strongly support your self-evaluation and narrative. The reflective practice approach used by CILIT Professional Registration and others may be useful here. It's important that you address the so what question with your evidence. How do you make a difference to your organisation and what impact do you have? We will also ask you to pull out a list of your key strengths and examples of good practice on a form shown here on the right. This will help us to share this good practice with the whole network. We will talk about the pandemic specifically in a moment, but suffice it to say here that you can obviously include information about COVID in your narrative, and particularly where you need to highlight the effects of the pandemic on your service, both positive and negative. The baseline self-evaluation submission must represent your organisation and knowledge and library service during 2020 and 2021. Therefore, evidence to support the evaluation should cover the year 20 to 2021. However, owing to COVID-19 and the delay to the initial baseline, you can also use evidence collected from 2019-20 as appropriate. This will ensure that any new developments, service improvements, changes in the way of working as well as any risks to services over the last 12 months, are picked up in the evaluation. We do provide some guidance on the website in terms of how you may like to do that. However, you can be pragmatic in your approach to ensure that the evidence you include represents the current service status by using the following guidelines. If you have evidence from 2020-21 and it does demonstrate your level within an outcome, please just include this. If you don't have evidence from 2020-21, but the evidence from 2019-20 is substantial and still reflects the current service offer and outcomes, then use this but explain why in your narrative. If you're using evidence from 2019-20 and the activity or service has changed substantially since then, please highlight this in your submission. You can include evidence from both years against a level or indicator if you think it's necessary to demonstrate the level you're working at, and particularly if it shows an improvement story. If there have been significant changes between 2019-20 and 2020-2021, for example, any issues or risks to your services, funding or resources, then please do make this clear in your submission. Please remember to use evidence examples already available to you. And also remember that if evidence is dated prior to 1919-20, then it is not valid unless you provide a valid explanation. We appreciate that it has been a very tough 18 months for many library services and library staff. However, we also know that many of you have done some great work during this period. We're keen to ensure that the baseline narrative and evidence accurately reflect your current service, as an accurate baseline will be useful as a way of considering a service improvement approach. You can use evidence from how your service has responded to COVID-19 in your submission. We'll share some ways in which you may choose to do this. You could tell us about developments and services that you have put in place to support getting evidence into practice around the pandemic and responding to service needs. You may have been doing work supporting trust board and senior decision making. You may have continued engagement with healthcare staff, senior managers and stakeholders, even if service delivery and development itself have been postponed. You may have evidence of adapting and responding to needs, such as adapting the library to allow staff and learners to use the space and resources for health and well-being. You can include action plans which give a picture of your strategic planning and progress, even if areas within it have been postponed due to COVID. You can include any learning from experience, for example, if staff have been redeployed during the pandemic. How have they used their knowledge and library skills in their redeployed roles, and have they made new contacts and been able to promote the knowledge and library service as a result of this? The pen portrait will be a useful document for providing the validators with an overview of your situation, an opportunity to highlight any changes owing to COVID, such as redeployment and shielding of staff, which may have had an impact over the last 12 months. We have tweaked the pen portrait over the last year to include some prompts for you to tell us how the pandemic may have affected your service. If you've used an earlier version of the form, then please don't worry, but you may want to consider adding some notes relating to the pandemic if you haven't already done so. A reminder that we're not expecting pages and pages of information in the pen portrait. It's an outline of your service to help the validators who may not be familiar with your organisation. As you can see, there are prompts for you to enter details about your staffing, the organisation served, and any physical service points you may have. There's also a section for you to add the core evidence, as we mentioned earlier, the strategy, the implementation plan, an annual report, and any service level agreements which you may have in place. The document also includes an action planning template. This answers the what next question. Through your service evaluation, you'll be reflecting on where your service can be improved and the steps you could take to move to the next level. It's useful for your planning process to capture your thoughts about how you might approach these improvements and any priorities you may have. Senior stakeholders will be reassured to see your action plan, so do complete this stage. Think about how a quality improvement approach can help you achieve these improvements. This year we'll be asking you to submit your self-evaluation and the associated documentation through a LibGuide site, similar to that shown on the slide here. You will receive a login for your organisation's submission, which you can pass on to whoever is managing the submission process for your organisation, if this isn't in the Library and Knowledge Service. We will provide a guidance document which covers how to access the site and submit your documentation. And this includes naming conventions for your documents to help us identify them when HE validators start to review them. As a reminder, the documents which you need to submit are the pen portrait, telling us about your service, the self-evaluation and evidence reporting template for your narrative and evidence, the self-evaluated and validated levels report template, the short document where you record your level for each outcome, and the action plan. We provide a template for this, but you may use a different format if you wish. Many organisations with an education contract are served by one dedicated in-house Knowledge and Library Service. And for these organisations, the Knowledge and Library Service will self-evaluate against the outcomes and provide evidence for the impact on the host organisation. If your Knowledge and Library Service provides services under an SLA to other organisations with an education contract, you will be asked to contribute to that organisation's self-evaluation. You may find that you're reaching the same levels for this external organisation as you do for the host organisation, but it's an opportunity to consider whether your reach and impact is identical across all the organisations which you serve. You will need to provide evidence which refers to the organisations being assessed in your submission. In some geographies, multiple library services collaborate to support one organisation, often in the case of community or mental health trusts. The best way to contribute to the self-evaluation in this case is by bringing together an evaluation team across the different services to produce a collaborative return. If you have any concerns about how this may work for you, then do email the HE Knowledge and Library Services team and we'll follow it up with you after the webinar. Email addresses will be shown at the end of the presentation.
We will now look at the process and timelines for baseline validation. Baseline validation will be carried out between October 2021 and February 2022. This is a new process and we need to ensure that the baseline is correct for everyone to support and enable service improvement. To date, quality assessment processes have been done by HEE Knowledge and Library Services teams regionally. This baseline self-evaluation and validation is our chance to get a truly national perspective on service quality. Validation will therefore be a single national process. Each return will be reviewed by 2 people, one from the HEE KLS team from the region of submission and one other likely to be from another region. We will also be putting a consistency checking and calibration process in place to ensure equity and consistency across the board. For the baseline validation, we're not including peer reviewing, although we do hope to implement that in the future. Reports from the baseline validation will be sent back to organisations in March and April 2022. This will include a validation of the levels and feedback on good practice and areas for service improvement. We will also be aiming to represent the validation of levels in a radar chart. To align with the HEE quality framework, we will be feeding back the outcomes of validation to the national and regional quality teams. So what will we be looking for when validating self-evaluation? We have 4 validation principles: currency, relevancy and consistency, outcomes focused, and so what. When we say so what, we are looking to see that you are reflecting on your service, its impact, and how you hope to continue to develop it. When looking at the evidence you provide, we want to see that it's relevant to the point you are making, that it shows the level you are working towards, which, remember, is about quality rather than quantity. We want the evidence to confirm the level of development. Please make sure that it relates to the relevant time period you are showcasing. We also would like to see that development is embedded in your service planning through your evidence. As I said, the validation reports will be returned to organisations in March and April 2022. This will include a validation of the levels and feedback on good practice and areas for service improvement. We'll also be aiming to represent the validation levels in a radar chart, like the one you can see here. Now we'll have a quick look at the support available during the baseline self-evaluation. Most of what has been discussed can be referred to in the handbook and in the self-evaluation and validation guidance. There are other documents which are there to help you at different stages of the quality and improvement outcome framework and after baseline, such as the glossary, the blog, the self-evaluation and evidence report template, the appendix, the improvement planning worksheet, and the quality improvement outcomes for healthcare KLS action plan. These are documents which you fill in as you work through the process, but they are also designed to guide you. Don't forget, there are also webinars for each outcome available for you to watch on the blog. If you have any questions, please do send through to your regional contact. You will find your regional contact's details on this slide. I'm now going to pass to Claire, who will talk a bit about how the process will continue after this baseline year.
We wanted to share with you our thinking on the process for the evaluation and validation of the outcomes framework. We are working towards the full evaluation and submission process being carried out on a 3-yearly cycle, with a requirement to submit some key documents on an annual basis. The process for self-evaluation of the outcomes framework following the baseline is based on the principles of sustainability and enabling organisations to have sufficient time to implement the improvements identified by the initial outcomes framework baseline, thereby supporting service improvement within knowledge and library services. The proposed assessment cycle is also based on the current evidence, which shows that most national quality processes are based on a 3 to 5 year assessment cycle. The process and timeline align to the publication of Knowledge for Healthcare 2021-26 and will demonstrate the progression of services from the baseline. So what will be required annually? To allow for recognition of good practice and to identify any issues and risks, we are considering that the following documents will be submitted on an annual basis: details of progress and next steps against the service improvement plan, progress against service strategy implementation plan, and annual report. A full self-evaluation and validation for all organisations will be carried out via a 3-yearly cycle. Following the baseline submission in 2021, The next period for evaluation will be April 2022 to March 2023, with a full submission after April 2023. This will allow a reasonable period in which action can be taken by organisations and services following feedback from the baseline. We are currently working with the HE quality team to see how this integrates with assessment of the quality framework, and this will determine the exact dates for submission. Between 2023 to 2025, to implement the 3-year cycle, 1/3, approximately 75 to 78 of organisations will be asked to submit a fully evidenced submission each year.